Thank you for watching the video. This is YouTube Medical University. Suddenly, I have a question for everyone at your home. Do you have Loxonin or similar types of painkillers or analgesics at home? This Loxonin is really reliable when you have a headache, menstrual pain, or when you get injured. We medical professionals also sometimes prescribe this medicine at hospitals. Some say they keep it at home as a good luck charm because it's so effective for pain. Today, I want to share some key facts about Loxonin, that convenient medicine. I'll discuss some unexpected side effects from a doctor's perspective. Recently, Ms. A woman in her 50s, visited my outpatient clinic. She told me she'd recently noticed swelling in her legs with sock marks clearly visible, which worried her. Listening further, I learned Ms. A had increased knee pain for about a month and had been taking Loxonin at home continuously. That's right, whenever she was in pain, she made sure to take Loxonin right away without pushing herself. She added that this has helped her stay active and keep moving. However, a closer examination confirmed that Loxonin caused the swelling in her leg. It was a side effect that strained her kidneys. Her body couldn't expel waste and fluids as urine, so fluid accumulated in her body. We found out that her legs were swollen. Those who have studied this well might already know about leg swelling. There were also symptoms like shortness of breath and blood pressure problems. There are some unexpected side effects. While medical professionals may know these, I'll share 5 lesser known side effects among the general public. And in the latter half of the video I'll talk about how to use Loxonin wisely. Are there any other ways to relieve pain besides Loxonin? If you use Loxonin as a patch, will there be fewer side effects? There's also a way of taking Loxonin that can significantly reduce pain. Please be sure to watch until the end. If you use this medicine incorrectly, a drug that's supposed to protect your body can unknowingly harm you. In some cases, it can cause bleeding from the stomach and even become life-threatening. I've seen many people like that. Some of this content might be a bit alarming, but please don't worry. By watching this video until the end, I believe your vague anxiety about the medicine will turn into solid confidence in using Loxonin correctly. Please stay with me until the end. First, in the opening section, I'll briefly explain how Loxonin works and its main effects, focusing on this key point. Just knowing this part alone. The side effects section in the second part will connect to this and make it easier to remember and understand, so please listen for a bit. If you just want to know about the side effects and aren't interested in this part, feel free to skip ahead and start watching from the second part. So, why does Loxonin work so sharply and effectively? The secret lies in what Loxonin really is and how it works. Loxonin, in technical terms, is classified as a non-steroidal anti-inflammatory drug. It belongs to a group called NSAIDs. Over-the-counter drugs like Eve or Voltaren are also classified in this category, the group called NSAIDs. As the name suggests, anti-inflammatory drugs work in the body. They help reduce inflammation. These medicines work like putting out a fire. When you get injured or catch a cold in your body, when your throat hurts or is inflamed, prostaglandin acts like a fire in your body. The inflammatory substances, which are like the flames, are produced. Because of this, we feel pain. This is how the body recognizes that it's in a dangerous state, but that pain is really tough to deal with. Loxonin stops the production of prostaglandins, which are the substances responsible for inflammation. That's how it works. It's a revolutionary medicine that eliminates pain at its source and is commonly used. It's not exactly clear how the medicine called Calonar acetaminophen works, but it's believed that it probably shuts out the part of the brain that senses pain. Loxonin, on the other hand, doesn't work that way. It suppresses the inflammatory substances that are the root cause of pain, so not only does it relieve pain, but it also reduces swelling and improves the inflammation itself. That's the advantage of this medicine. Loxonin reduces swelling and heat. These are some expected effects. I think it's easier to understand if you remember the differences. However, this wonderful effect of Loxonin, which blocks prostaglandins, is also the cause of various side effects that I'll talk about in the next section. I'll explain in the next section. What happens if you take it daily? Here are 5 dangerous Loxonin side effects. First, gastrointestinal issues. The stomach lining thins. This is Loxonin's best known side effect. Many of you may know this, but taking Loxonin can cause stomach pain, weaken your stomach, or lead to gastritis or ulcers. Many people are vaguely aware of this. If you heard the first lecture, this will be easier to understand. Actually, this substance called prostaglandin, which is the source of inflammation, also protects the stomach lining. It also has that function. In fact, prostaglandin was protecting the stomach lining from a certain powerful and dangerous liquid that flows into the stomach. The dangerous liquid is actually stomach acid. Stomach acid, a digestive enzyme from the stomach, is much stronger than lemon juice. When stomach acid comes up in a burp, it tastes sour and can cause a burning chest sensation. These symptoms result from acid damaging the mucous membrane. Taking Loxonin weakens this barrier, which can irritate and inflame the stomach. In severe cases, it can cause a stomach ulcer, leading to bleeding where a hole forms. That can happen. I also do endoscopies, and when patients have stomach pain, I often see more stomach ulcers in those taking Loxonin. In the worst case, the bleeding may not stop, and we might need to cauterize the stomach lining or perform surgery if a hole forms. Taking Loxonin on an empty stomach is especially likely to cause direct damage to your stomach. Please make sure to always take Loxonin after meals. There are many people who end up taking Loxonin even when they're hungry because they want the pain relief quickly. However, if you try to eat something before taking Loxonin, it will make stomach problems less likely. What happens if you take it every day? The second of the 5 dangerous side effects of Loxonin is medication overuse headache. It sounds like a dangerous name, but I think many people might not know about it. This is a very paradoxical and quite ironic symptom. If you take too many painkillers, you can actually end up getting headaches because of it. If you suffer from migraines and often take painkillers like Loxonin, you need to be careful. In that case, it's not the migraine causing your headache, but the painkiller overuse that's triggering it. That's a possibility. I had a patient like this, a woman in her 40s who usually did desk work. She told me, looking very distressed, that her headaches would get worse in the evening, so she took Loxonin every day because she couldn't afford to lose focus at work. She said, "Doctor, lately even the painkillers don't seem to work, and the pain doesn't go away even when I take them." That's how she consulted me. It turned out the pain was actually caused by the painkillers. It was a medication overuse headache. By gradually and systematically reducing the painkillers, the frequency of headaches actually decreased. The possibility of this medication overuse headache increases, so please keep it in mind. For those who have headaches more than 15 days a month and take painkillers like Loxonin, if you're taking them over 15 times a month, that's quite often. For example, if you have headaches every other day and take Loxonin each time, the painkillers themselves might be causing your headaches. If you suspect this, count how often you take painkillers each month. Please keep a record on a calendar or in your phone's notes and consult your doctor when you visit the hospital. That record itself will become very important information for your treatment. What happens if you take it daily? The third of Loxonin's 5 dangerous side effects is kidney dysfunction. This is the symptom Mr. A, whose swollen legs I mentioned earlier, had, especially when taking Loxonin. If your kidney function is already impaired, please be careful. Actually, as I mentioned in the first part, it can be the cause of serious trouble. Prostaglandin is actually a substance that also regulates blood flow in the kidneys. In other words, taking Loxonin stops prostaglandin production, reducing blood flow to the kidneys. As a result, reduced kidney blood flow makes waste removal through urine harder. This can cause swelling, and as kidney function worsens, toxins build up, making you feel very sluggish and tired. You may even develop a condition called uremia. So while this medicine called Loxonin can be purchased at drugstores, it's important to check whether your kidney function is declining or not. I think it's best to regularly monitor this with blood tests. Such checkups. Taking medicine without doing so is very dangerous, so when you buy it, be sure to consult with the pharmacist at the drugstore. Be sure to visit a hospital to check if the medication is safe for you. Even Mr. A at the beginning said he had no idea he was putting so much strain on his kidneys. What's even more important to be careful about is this. Dehydration is a concern in summer, as sweating can affect even your skin. The blood flow to the kidneys decreases. If you take Loxonin on top of that, it further decreases blood flow to the kidneys, which can suddenly worsen kidney function and, in the worst case, even become life-threatening. So, the main point I want to convey here is, when you take Loxonin, make sure to take it with plenty of water. Some people take it with green tea or coffee, but these drinks have diuretic effects, so dehydration is hardly improved by them. To take care of your kidneys, make sure to drink a full glass of water whenever you take Loxonin. What happens if you take it every day? Here is the fourth of the 5 dangerous side effects of Loxonin. It's an increase in blood pressure. Lately my blood pressure has been going up. that could actually be related to Loxonin as well. The prostaglandin I mentioned earlier actually has the effect of dilating blood vessels. So when that gets blocked, since the blood vessels don't dilate, the pressure inside the blood vessels increases. In other words, blood pressure goes up. Mr. C, a man in his 60s, had high blood pressure and was taking his medication diligently. However, for some reason, his blood pressure readings at home had recently started to rise. He wondered why, as his lifestyle hadn't changed. When I asked further, he revealed he'd recently played golf. Afterward, he would get muscle pains, so he was taking Loxonin. He took Loxonin several times a week. Sometimes his blood pressure would easily go up, but when he wasn't taking it, his blood pressure was low. In other words, Loxonin was believed to have caused Mr. C's unstable blood pressure. Some people take Loxonin regularly, which raises their blood pressure and is mistaken for hypertension, leading to unnecessary medication. Some patients take medication long term. When a new drug is added to treat another drug's side effects, it's called a prescribing cascade. This is called a cascade, which happens often. For example, taking Loxonin raises blood pressure, leading to more medication to lower it. You take a medication, and as a side effect, your legs swell, so you get prescribed a diuretic to increase urination and reduce the swelling. You're prescribed another medication which disrupts your mineral balance and requires potassium supplements. It's like you get prescribed one medication after another, and the number of medications just keeps increasing. Those things happen. People say medications have risks, and Loxonin is mainly for emergencies. This is a medication you take temporarily when you're in pain and having a hard time, and then you stop taking it. So it's very dangerous to keep taking it all the time. If you usually take blood pressure medication or think your blood pressure is high and you're also taking Loxonin, please check with your primary doctor or a nearby internal medicine or general practitioner to see if there could be any effects from the medication. At YouTube Medical University, as a practicing physician, I want to share important information for the public to know and consider. I explain medical info simply. Before you forget which channel this is, please subscribe to the channel. What happens if you take it every day? Here are 5 dangerous side effects of Loxonin. The 5th one is this. It's shortness of breath. What kind of relationship is there between Loxonin and shortness of breath? Have you ever heard of the term aspirin-induced asthma? Many of you probably know about asthma, right? When you cough, you wheeze and make a whistling sound. Asthma is a condition where you have trouble breathing because of that. Actually, among patients who have asthma, there are some called ESEZU. When they take medicine from this group, their asthma can be triggered or their asthma can get worse. These people are considered to have aspirin-induced asthma. In fact, about 1 in 10 adult asthma patients has this condition. Many people don't realize it, especially when taking painkillers and noticing something is wrong. If you felt shortness of breath or discomfort, you might have it. If so, from now on, please note on your calendar the days you take painkillers and check for shortness of breath. Remember, symptoms can appear with both oral medications and patches containing NSAIDs like Loxonin. Let's review what we've discussed so far. I explained that Loxonin can cause side effects like weakening the stomach's barrier, reducing kidney blood flow, raising blood pressure, and increasing shortness of breath. I also mentioned that taking too much of this medicine can actually cause headaches, which is an unexpected side effect. What kind of symptoms did you have? Maybe you've experienced the same symptoms yourself. I would be very happy if you could share your thoughts and experiences in the comments. I think it will be helpful for others as well. Although I shared a scary story in the 2nd period, from the 3rd period, I'll cover 3 key points doctors use to properly administer Loxonin. Before that, let me first introduce some other methods you can try before relying on painkillers. This doesn't work for things like a sore throat from a cold, but when you've hurt yourself from an injury and are thinking about taking Loxonin, these are things you should try together with the medicine, or even before taking it. Just because you're in pain, immediately relying on medication isn't always the best option, even if the pain is bad enough to consider taking painkillers. But I'll introduce some self-care methods that can help not only when the pain isn't severe enough for medication, but also when you're feeling a bit uncomfortable. For example, people who do desk work often experience headaches caused by stiff shoulders. Before reaching for painkillers, how about trying some shoulder stretches first? There are a lot of muscles gathered around the shoulders. Any kind of stretching can be effective. For example, a common stretch is to extend your shoulder like this. There's also a stretch where you clasp your hands and raise them overhead, which Shohei Ohtani and others have practiced. But there's also a stretch where you stand at attention like this. Bring your elbows forward and move in a way that opens up your shoulder blades, just by stretching the shoulder muscles in all directions like this. But this will help relieve shoulder stiffness. And to help you relax, sometimes it's effective to warm your neck with a heated towel or something similar. And when you have pain from a bruise or an injury, the rest, ice, compression, elevation treatment is important. Rest, ice, compression, elevation stands for rest, ice, compression, and elevation, the main treatments. For example, if you hurt your wrist, you should rest it and avoid using it. And to prevent the inflammation from getting worse, you should cool it with ice. Increased blood flow worsens swelling, so apply pressure with a bandage or similar item. To prevent blood from pooling, elevate it above heart level. These simple first aid steps are sufficient, but the pain will ease a little, and how the pain develops afterward will also change quite a bit. If you only recall a one-to-one idea like pain equals medicine, as I said in the second lecture, it could cause medication overuse headaches. When you're in pain, what else can you do besides taking medicine? It's very important to have more options and not rely solely on medication, so please remember that. Now let's get back to the topic, and I'll introduce 3 golden rules that doctors follow to use Loxonin wisely. Here's the first one. It's to take it at the onset of pain, not at the peak of pain. When do you usually take painkillers? I think many people endure the pain as long as they can and only take painkillers when they can't stand it anymore. It's important to try to hold off on taking them, but if you end up taking them anyway, it's also very important to take them as soon as the pain starts. This way of taking painkillers is especially important for things like menstrual pain, and it's also very effective for patients with migraines. Migraines and menstrual pain tend to come in cycles, right? When you feel like a migraine is about to get worse, or if it's your period and you know the pain will start soon, in situations where you can expect the pain to get stronger, take a painkiller like Loxonin or ECs as soon as pain begins, as I mentioned in the first lecture. These groups of medicines suppress the root cause of the pain, so if you can control it early on, the pain will be less intense afterward. However, if you take it during peak pain, the cause of the pain has already produced a lot of acid, so the medicine can't suppress it very well. It's easier to understand if you consider the reason. Even women who've had severe menstrual pain. Some people say that ever since they started taking it this way, the pain on the second day has become completely different. For those who suffer from migraines, I also tell them to take the medicine as soon as the pain starts and to always keep it in their wallet or work bag. When I advise them to keep painkillers hidden in various places, they say that the pain is much more manageable and it has less impact on their work. Fires are hard to put out once they start, so it's important to extinguish them before they spread. This is the basic principle of painkillers. Of course, you need to be careful. Taking painkillers just because you're afraid pain might occur can easily lead to overuse, so that's not allowed. The important thing is to take them only after the pain has started, so please keep that in mind. The second rule is to approach using patches with the same seriousness as taking oral medication. This is something I often hear from the general public. They ask if using pain relief patches means there won't be any stomach or digestive issues, but that's not true. Pain relief patches like Loxonin tape are ultimately absorbed through the skin and circulate throughout the entire body. So, as a result, they can definitely cause stomach or digestive issues as well. In other words, just like oral medication, as I mentioned earlier, side effects like kidney strain or worsened asthma can still happen, so don't assume a patch is entirely safe. Please don't use these patches daily as part of your routine. Patches are intended as a temporary pain relief, so Loxonin patches and oral Loxonin serve the same purpose. Please make sure to keep that in mind. Lastly, the third point is to avoid taking it on an empty stomach and to use it for a short period only. I've mentioned this many times, so it might not be surprising, but it's the most important thing. I believe the most serious side effect of Loxonin is gastrointestinal issues. Some people experience indigestion and others may need a blood transfusion due to massive bleeding from a gastric ulcer. This often happens to people who take Loxonin on an empty stomach, so it's important to eat something before taking Loxonin. Please keep that in mind. Taking it more often or in larger amounts increases strain on your organs. Loxonin is an excellent medication that I use and prescribe, but I almost never recommend it for long-term use. For some patients, I prescribe stomach medicine with Loxonin to prevent ulcers. Some people need it. Since this medicine requires caution, over-the-counter options are convenient, but if you have concerns, it's best to consult a doctor first and consider if you should take stomach medicine as well. I'll say it again. Avoid taking it on an empty stomach and use it only for a short period. Please remember just this. How was it? Thanks for your effort in third period. I think you now understand that behind the powerful effects of Loxonin there are many side effects you need to be careful about. It's a good medicine when used wisely and safely. Don't rely too much on it. Listen to your body as you use it. You cared about your health and watched the video to the end. I think you are very health conscious. That kind of knowledge will help your health. A year or even 10 years from now it will protect you. Let's keep building a future where we care for our bodies. If you found today's video helpful or learned something, hitting the like button and leaving your thoughts in the comments would really encourage me. And for things you don't want to forget or want to remember, make a note of them. I think leaving a comment helps things stick in your memory, so please feel free to leave a comment.